Welcome to Medical Lecture Series. Today is pathology. We are going to discuss systemic pathology, and in systemic pathology, we are discussing male reproductive system pathology. This is a very important session to understand because the main patient will present to hospital. Some of the complaints which they will present will be due to pathology in male reproductive system. So it is a very important session to understand as far as medical practice is concerned as you are preparing to become a doctor. My name is Dr. Machera. You are only welcome to this discussion, and these are lectures dedicated to clinical officers and students. Remember to subscribe and put a notification on so that you can be updated with the upcoming lectures. I used to update lectures daily, so it's very important to subscribe and have a notification on so that you can be updated with the upcoming lectures. In this discussion, we are going to have objectives. These are learning objectives. Number one, we have introductory part where we describe male genital disorders at the whole. After that, we have to describe pathology affecting an individual organ. Remember, the male reproductive system is made up of organs. We shall see them. We have the penis, we have the scrotum, of course, we have the epididymis, we have the spermatic cord, the prostate gland, and the other accessory gland. So we have to describe pathology of these organs. And why we are discussing them individually, it's because the pathology affecting male reproductive system do affect this organ in a selective fashion. So due to that, we have to describe pathology of the penis. Then we have to describe pathology of the scrotum, and then we have to describe testicular disorders, and then we have to describe inflammatory processes of the prostate gland, and we have to finish with the neoplasia condition of the prostate, in which we discuss benign neoplasia of the prostate gland, and we have to describe malignancy, which is carcinoma of the prostate gland. The overview of male reproductive system. Generally, we say pathology affecting male reproductive system are categorized into three categories. We have pathology which are due to congenital malformation. So when you are discussing pathology of an individual organ, we have to describe congenital malformation in each organ. That is category number one. Category number two are due to inflammatory processes. So also we have to describe inflammatory condition affecting each organ. And the last category are neoplasia. So we have to describe neoplasia of each organ in male reproductive system. Remember, pathology of male reproductive system are grouped into three categories. We have pathology due to congenital malformation. We have pathology due to inflammatory processes, including bacterial infection. We have pathology due to neoplasia. So, as I said, pathology affecting male reproductive system do affect them in a selective fashion. So, we are going to discuss this pathology in an individual organ. I would like to start with reviewing anatomy of male reproductive system. The anatomy of male reproductive system is made up of the penis. Of course, the penis helps us for urination as well as introduction of sperm into the vagina during sexual intercourse. We have also the spermatic cord. Of course, the spermatic cord contains testicular vessels, testicular artery and the vein. It has also the testicular nerve and the sperm duct. We have the epididymis. Of course, the epididymis is important. It is found in close relationship with the testes. In the superior aspect of the testes, it is important for temporary storage of sperm for maturation. We have the test, which is important for sperm formation as well as male sex hormone production. We have the prostate gland with the other semenovesical gland and the corpus gland. These are very important glands because they produce semen which contain nutrients and alkaline, which neutralize acidic medium in the vagina so as to protect the sperm from being destroyed by the acidic environment of the vagina. So you have also to describe pathology of the prostate gland. To start, as I said, pathology of male reproductive system do affect this organ in a selective fashion. So we are going to start pathology of the penis. As I said again to insist, generally, pathology of male reproductive system are grouped into three categories. We have congenital malformation, we have neoplastic, we have inflammatory processes. So we are starting with the inflammatory condition of the penis. Inflammatory condition of the penis are most commonly caused by sexual transmitted infection, particularly bacteria, but also poor hygiene, particularly in uncircumcised male, can cause local inflammatory in the penis. So we say the penis can be inflamed. The head of the penis can be inflamed. Do you remember the penis has the shaft and had the head? This head is known as the glans penis. So inflammation of the glans penis is known as balanitis. So balanitis, this is a term which is used to describe local inflammation of the glans penis. Also, we are moving on to another terminology. Do you remember the penis has the shaft, it has the head, and in an uncircumcised patient, this head is covered by the overlying skin, or sometimes we call it the foreskin, but in medical terminology it is known as the proprius. So you can also have inflammation of the proprius, the overlying skin on the glans penis. The local inflammation of the proprius is known as prostatitis. Prostatitis, this is an inflammation of the overlying skin of the glans penis. Overlying skin of the glans penis is known as proprius. Because of close relationship between the glans penis and the overlying skin, sometimes it is very difficult to have isolated infection of the head itself without involving the overlying skin. So due to that, we prefer to use the term balanoposthitis. Balanoposthitis is a terminology which is used to refer local inflammation of the head and the overlying skin, and this occur in uncircumcised male. Remember, once a male is circumcised, he will not have this proprius. So we don't have balanoposthitis diagnosis in circumcised patient. We have balanoposthitis in uncircumcised male. But because both circumcised and uncircumcised, they do have the head of the penis or the glans penis. So we have balanitis in both circumcised and uncircumcised male. But we don't have balanoposthitis and we don't have prostatitis in circumcised male, because the circumcised male, the overlying skin have been removed, so there is no local inflammation of the overlying skin. I'm insisting that don't make a diagnosis of prostatitis in circumcised male. We only have that diagnosis in uncircumcised male. And balanoposthitis, it is also in uncircumcised male. In such case, we say the distal penis balanitis, when there is a local inflammation, the distal penis will be typically red, swollen, and tender. Of course, red, swollen, and tender, these are signs of acute inflammation. Sometimes when there is inflammation due to microorganisms such as bacteria, they may cause discharge. So we say they can also be prudent discharge. As we are discussing inflammatory condition, of course, I'm trying to mention bacteria are the most common causative, but fungi are also not left behind. Particularly fungi, they love to infect the skin of the penis and the scrotum. And the reason behind it is because fungi from microbiology, we know that they love to grow in warm and moist environment. So these areas, because they are covered by underwear and other clothes outside, so they are warm and moist. So this environment do favor fungi growth. That's why fungi, they also cause skin infection of the penis and the scrotum. So in fungi category, the most common is candidiasis. Candidiasis typically present as an erosive, painful, and pruritic lesion. Remember, fungal skin infection, they present with itching. That's why I said pruritic lesion. For diagnostic purpose, when we want to do investigation, you can do scrubbing of the skin or biopsy, so that you can send it to lab, which will reveal characteristic budding of the yeast form and the pseudohypha within the superficial epidermis. This is a lab investigation in skin fungal infection affecting the penis and the scrotum. Coming to congenital malformation of the penis, as far as this session is concerned, I would like to mention hypospadias and epispadias. These are most commonly congenital malformation of the penis. These hypospadias and epispadias refer to abnormal location of the distal urethral meatus. Normally, the urethral meatus should be at the tip of the glans penis. So you may find there is abnormal location of this meatus. It can be in the dorsal aspect or it can be in the ventral aspect. So abnormal location of the distal urethral meatus is known as either hypospadias or epispadias. Hypospadias, this is when the distal meatus of the urethra is found in the ventral aspect of the penis. Ventral aspect. That means in this, for example, this, if this is your penis, so the distal meatus will be in inferior aspect. We say ventral aspect of the penis. Of course, sometimes anatomically it is very confusing to tell a student that inferiorly, when your penis is erected, downward inferiorly is ventral aspect, while the top surface is dorsal aspect. So when there is inferior opening of the distal meatus, this is what we call ventral aspect, and it is hypospadias. Epispadias, this is when the distal urethral meatus has opened on the dorsal aspect of the penis. Both hypospadias and epispadias can have the complication. One of these complications is lower urinary tract obstruction. That's number one. In the other case, the condition may lead to urinary incompetence. Also to mention, depending on the severity of the epispadias or hypospadias, patient can present with infertility. This will be infertility due to problem of ejaculation, because when you are ejaculating, the sperm will be passing ventrally or dorsally. They will not go directly into the vagina. Abnormality of the penis, congenital abnormality of the penis, either hypospadias or epispadias, they tend to involve other congenital anomalies such as inguinal hernia and undescended testes. That is to insist, when you are having a patient with hypospadias or epispadias, it's very important also to make sure you rule out other congenital anomalies such as undescended testes and inguinal hernias. Coming to neoplasia of the penis, 95% of neoplasia of the penis are due to squamous epithelium. Remember, the skin of the penis and the scrotum are covered by squamous epithelium. So when you have neoplasia of the penis, the most common neoplasia will involve squamous epithelium of the penis, and it occurs particularly in uncircumcised male over 40 years of age. These neoplasia, as I said, they are squamous carcinoma. They are malignant. They are squamous carcinoma of the penis. We have several factors which have been implicated in pathogenesis of squamous cell carcinoma of the penis. These include poor hygiene, of course that's a risk factor, smoking, also it is a risk factor, and infection with viruses such as papilloma humani virus, type number 16 and number 18. So virus, human papilloma virus, is the most common risk factor for neoplasia of the penis. As with squamous cell carcinoma at the other site, carcinoma of the penis are generally preceded by appearance of malignant cell confined to the to the epididymis, and this is termed as intraepithelial neoplasia or carcinoma in situ, meaning that they are positioned in the epidermis of the skin. They have not metastaticized to other areas. We say they are confined. They are carcinoma in situ. So we have finished the pathology of the penis. We are now to discuss the pathology of the scrotum, and I would like to say that this is a very long discussion because the male reproductive system has many organs, so we'll continue with the scrotal disorders in other lecture video. So thank you. Stay updated for other lectures when we proceed with the scrotal disorders.